the Department of Health and Human Services. It sounds vital, doesn't it? A guardian of public well-being. Yet, sometimes the biggest names hide the biggest problems. HHS is a giant. It commands a budget that rivals the economies of small nations. It employs tens of thousands of people. Its responsibilities stretch from the search for new cures to the safety of our dinner plates. But is it working? HHS oversees agencies like the FDA, CDC, and NIH. It manages massive programs like Medicare and Medicaid. Each of these components is a world unto itself. When you stitch them all together, what do you get? Is it a symphony of coordinated effort? Or is it a cacophony of competing priorities? The evidence points more towards the latter. It suggests a system struggling under its own weight. The idea of questioning such an established institution can feel radical, but progress often requires us to question the status quo. The conversation around HHS is not just about tweaking a few programs. It's about whether such an all-encompassing health department is the most effective way to achieve our national health goals. Inefficiency is a quiet saboteur. Within the Department of Health and Human Services, this erosion has been a persistent concern. We see it in delayed initiatives where promising programs get bogged down in layers of approval. We see it in the stories of wasted funds, where taxpayer dollars don't translate into tangible public benefit. The sheer size and complexity of HHS often lead to bureaucratic paralysis. Decisions that should be swift become protracted. Resources that should be deployed efficiently are instead consumed by administrative overhead and internal redundancies. The numbers themselves tell a story. With a budget exceeding $128 billion in fiscal year 2024 for its operational components, even small percentages of inefficiency translate into staggering sums. Consolidating divisions and centralizing functions might offer some relief, but do they address the fundamental misalignment of responsibilities? The goal should be a lean, agile system where every function has a clear home and every dollar is maximized for impact. The current structure of HHS struggles to achieve this ideal, simply because its mandate is so incredibly broad, encompassing too many disparate missions under one roof. Accountability is the bedrock of trust in public institutions. When it comes to health oversight, particularly concerning the pharmaceutical and food industries, the stakes could not be higher. Yet the current framework, largely managed under HHS, has shown significant vulnerabilities. We hear too often of loopholes in regulations, of delayed actions when public safety is at risk, and of a system that seems more reactive than proactive. The consequences of this accountability deficit can be severe, impacting the health and well-being of millions. The pharmaceutical industry, for example, operates under a complex web of regulations overseen by the FDA, an arm of HHS. While the goal is to ensure drugs are safe and effective, the process can be slow and the enforcement mechanisms sometimes lack the necessary teeth. Social Security is a cornerstone of American life. It represents a promise made to generations of workers, a promise of financial support in their retirement years. Its administration is a monumental task, involving vast sums of money and intricate record-keeping. Currently, the Social Security Administration, SSA, is an independent agency, but its broad mission aligns with human services, often linking it conceptually with HHS's domain. However, if we consider the fundamental nature of Social Security, it is primarily a massive financial trust, a system of collecting contributions and dispersing benefits. This core function resonates deeply with the expertise and mandate of another key government department, the Treasury. Placing the Social Security Administration under the oversight of the Treasury Department could be a transformative move. The Treasury's entire existence revolves around managing the nation's finances, ensuring fiscal responsibility, and overseeing complex financial systems. Aligning Social Security with this expertise makes inherent sense. It would bring a laser focus to the financial integrity and long-term solvency of the Social Security trust funds, ensuring they are managed with the utmost prudence and skill. Medicare and Medicaid are pillars of the American healthcare system. They provide essential health coverage to tens of millions of seniors, individuals with disabilities, and low-income families. The Centers for Medicare and Medicaid Services, or CMS, currently a part of HHS, manages these colossal programs which involve staggering sums of public money. The financial administration of Medicare and Medicaid is an undertaking of immense scale and complexity, involving payments to countless providers and the processing of millions of claims. Given this profoundly financial nature, a compelling argument can be made for transferring oversight of these programs to the Department of the Treasury. The Treasury Department is the nation's fiscal steward. Its core competency lies in managing vast financial enterprises, ensuring accountability for public funds, and maintaining the integrity of financial systems. Transferring Medicare and Medicaid to the Treasury would place their financial operations under the direct purview of the agency most adept at handling such responsibilities. This could lead to enhanced financial oversight, more rigorous auditing processes, and potentially more effective strategies for combating waste, fraud, and abuse, which are persistent challenges in these large healthcare programs. The goal is to ensure that every dollar allocated to Medicare and Medicaid is spent wisely and reaches its intended beneficiaries and purposes. The safety and efficacy of pharmaceutical drugs are non-negotiable. The public places immense trust in the regulatory system to ensure that medications are safe to use and do what they claim. Currently, the Food and Drug Administration, an agency within HHS, holds primary responsibility for drug regulation. However, concerns have persisted about the agency's ability to consistently enforce regulations with the necessary rigor and to hold pharmaceutical companies fully accountable for negligence or misconduct. The consequences of failure in this area can be devastating, leading to public health crises and eroding public trust. A new approach is needed, one that prioritizes enforcement and accountability above all else. Transferring the regulatory and, crucially, the enforcement functions related to drug safety from the FDA to the Department of Justice represents such a paradigm shift. The DOJ is the primary law enforcement arm of the federal government. Its mission is to enforce the law and defend the interests of the United States according to the law, to ensure public safety against threats, foreign and domestic, to provide federal leadership in preventing and controlling crime. The safety of our food supply is a fundamental public health concern. Every citizen deserves confidence that the food they purchase and consume is free from harmful contaminants and accurately labeled. The Food and Drug Administration, operating under the umbrella of HHS, currently bears the primary responsibility for overseeing the safety of a vast portion of the nation's food. However, recurrent outbreaks of foodborne illness, product recalls, and systemic issues like the infant formula crisis have raised serious questions about the effectiveness of the current regulatory and enforcement model. The public deserves a system where food safety is paramount and where failures are met with uncompromising accountability. Proposing the transfer of food safety regulation and enforcement to the Department of Justice is a bold step, but one designed to inject a new level of seriousness and consequence into this critical area. The DOJ's primary mission is law enforcement. Any proposal for a significant governmental reorganization, especially one as profound as the dissolution of a major department like Health and Human Services, must address the human element with utmost care and respect. The thousands of individuals employed by HHS are public servants who have dedicated their careers to various aspects of health and welfare. Their expertise, experience, and commitment are valuable. As functions are realigned and redundancies are eliminated, it is inevitable that some positions will become unnecessary. A responsible transition plan, therefore, must prioritize the well-being of these affected employees, ensuring they are treated fairly and supported in their move to new opportunities. Generous severance packages are a crucial first step. These packages should acknowledge the years of service and provide a financial cushion for employees as they navigate their career transitions. This is not merely a cost of reorganization, it is an ethical obligation. The proposal to dissolve the Department of Health and Human Services and realign its core functions is not born from a desire for disruption, but from a vision for a more efficient, accountable, and responsive system of health governance. The current structure, despite the best efforts of many dedicated individuals, has shown itself to be unwieldy, prone to inefficiencies, and sometimes lacking the sharp edge of accountability required for critical oversight functions. The path forward involves a bold reimagining, placing financial responsibilities with financial experts, and enforcement duties with dedicated enforcers. allowing for a more focused and effective approach to each vital mission. Imagine a system where Social Security, Medicare, and Medicaid are managed under the Department of the Treasury. This leverages the Treasury's unparalleled expertise in financial stewardship, ensuring these vital social safety nets are administered with the utmost fiscal prudence and integrity. The financial health of these programs, which touch nearly every American family, would be safeguarded by the nation's premier financial institution. This move alone would streamline operations and enhance accountability for trillions of dollars in public funds, ensuring they serve their intended purpose effectively for generations to come. It is a logical consolidation of financial responsibility. Gap 3S. The proposal to dissolve the Department of Health and Human Services and realign its core functions is not born from a desire for disruption, but from a vision for a more efficient, accountable, and responsive system of health governance. The current structure, despite the best efforts of many dedicated individuals, has shown itself to be unwieldy, prone to inefficiencies, and sometimes lacking the sharp edge of accountability required for critical oversight functions. The path forward involves a bold reimagining, placing financial responsibilities with financial experts and enforcement duties with dedicated enforcers, allowing for a more focused and effective approach to each vital mission. Imagine a system where Social Security, Medicare, and Medicaid are managed under the Department of the Treasury. This leverages the Treasury's unparalleled expertise in financial stewardship, ensuring these vital social safety nets are administered with the utmost fiscal prudence and integrity. The financial health of these programs, which touch nearly every American family, would be safeguarded by the nation's premier financial institution. This move alone would streamline operations and enhance accountability for trillions of dollars in public funds, ensuring they serve their intended purpose effectively for generations to come. It is a logical consolidation of financial responsibility. Please subscribe to our channel, like this video, and share it with your friends. Your support helps us create more content like this.